You hear a doctor and a trainee discussing the application of a plaster cast.
So let's discuss the short arm cast that you're going to apply. What are the steps?
Well, first, I need to examine the area and check the x-rays to see if surgery is needed. For the cast, first I'll apply a stockinette with a hole for the thumb, and then I'll wrap the arm in a web drill for padding. After that, I need to immerse the roll of plaster in water.
Right. And what should you point out about the plaster?
I need to warn the patient that it may feel hot as it starts to set. How long does it take to dry?
The cast may feel dry to the touch in a few minutes, but it isn't fully dry for 72 hours. What's the last step?
After I've applied the cast, I need to take another x-ray to confirm that the fracture has been reduced.
You hear a manager explaining new data management processes to clinical staff.
Yes, in the back. You had a question?
Yes. How should we file our feedback reports? Do we need to just complete them on the computer?
That's a great question. Remember that since the clinic has begun transitioning to the new computers and software systems, we need you to fill out the paper reports in addition to the digital versions. I know this may be time-consuming, but this is because as we transfer all our files from the old servers to the new ones, some files may be misplaced, and we want to ensure that all of our records are easily accessible at all times.
So we need to make 2 copies of our reports?
Yes, exactly. Great. Does anyone else have a question?
You hear a presentation about the introduction of a new type of wound dressing.
Thank you all for coming. Well, after some research, the hospital has decided to invest in a new type of dressing to care for our patients with chronic wounds, such as those with diabetic ulcers. Although the traditional cloth compression bandages are useful, they need to be changed frequently to promote healing. These new bandages are made of a natural plant-based material instead. In fact, they're made from seaweed. Alginate dressings are somewhat costly, but they can prevent harmful strains of bacteria from entering the wound by forming a protective barrier with the skin. Most impressive of all, they can absorb up to 20 times their own weight, so they're the best choice for wounds with high-level exudate. Based on these factors, we believe that alginate dressing would be a useful addition to our wound care procedures.
You hear 2 hospital managers discussing completion rates for an online course.
It looks like only around 40% of the staff have completed the online health and safety course so far.
Less than half, but the course has to be completed by all staff members by the end of the month. Can we send them a reminder email?
We've reminded them by email twice already. I've even phoned a few people. I think we need to bring it up at the general staff meeting next week.
That's on Thursday afternoon, right? Will that work with everyone's schedules?
It should. All staff members have that time already blocked out. But if anyone can't come, then we can speak to them in person one-on-one.
You hear 2 colleagues discussing an online training course.
Hi Fiona, how are you? Can I ask you something?
Sure, Mug. What's up?
Have you done that online training for a new record management process?
Yeah, I did it on the weekend. It was supposed to take 10 minutes, but it took me ages.
Did you have any trouble with it? I mean, any technical problems?
Not really. I couldn't log in for a bit, but that was just me getting my password wrong. After that, it worked fine. Why?
I keep getting this email that says I haven't finished all the activities, and then when I log in, it says I've completed everything. It's driving me crazy.
Did you ring the IT help guys?
Yeah, they reset it. But it didn't do anything. I really don't want to do it again.
No, you shouldn't have to. Maybe just send the register an email and let her know that you've done it. Maybe she can fix the issue.
You hear an educator describing methods for creating medical abbreviations to nursing trainees. A technical name for the use of first letters is initialing, but I prefer to use the phrase the first letter rule for this method. Abbreviations using the first letter rule commonly identify diseases and diagnostic tests. For example, chronic obstructive pulmonary disease is COPD, or liver function tests are LFTs. In most cases, these letters are pronounced separately as letters, but sometimes key letters or key syllables form the abbreviation. For example, hypertension is abbreviated using HTN, or we see the term atrial fibrillation abbreviated as either AF or AFib. Sometimes the first letters form an easily pronounceable word, an acronym. For example, acquired immune deficiency syndrome becomes AIDS, or severe acute respiratory syndrome becomes SARS. Understanding these principles will help you to more quickly learn the many abbreviations used in local clinical settings.